Welcome to Theme 3. In this video, we will discuss initiating a patient on PrEP and how to take and store the drug. In the previous video for Theme 2, we discussed screening a client before prescribing PrEP. In this video, we will start looking at the process for initiating a patient on PrEP. Oral PrEP initiation. We recommend same-day initiation, but if that is not possible, initiation should happen within 1 month of screening. For same-day initiation, you will have already done the HIV test, assessed the risk, and conducted risk reduction counselling. You will also have done all the other screening procedures that day. You will dispense PrEP the same day after doing the following: providing combination prevention, as we spoke about earlier, including condoms, STI screening, pregnancy screening, provision of contraception, and providing other methods of HIV prevention. You will educate the client on important points, including side effects and practicing effective use, and ensure that all their other SRH needs are met. Lastly, you will prescribe PrEP as a combination of TDF 300 mg and FDC 200 mg in a fixed dose combination tablet per us daily for 1 month. At this visit, you will provide a script for 1 month's worth of PrEP and give the patient 1 month's supply. You will then give the patient a follow-up date for 1 month's time. If you do not do same-day initiation, you must initiate the client on PrEP within 1 month of screening. Initiation within 1 month of screening the patient is important because the other test results will still be relevant. However, you must still repeat the HIV rapid test. Other important information the client may need. Note that in the bottle, there are usually 28 tablets per bottle for 28 days of oral PrEP usage. When you schedule a follow-up visit, make sure that they have enough PrEP to last them until their next visit date. It is often useful to negotiate the follow-up date by asking the patient when would be most suitable for them. Patients need to be reminded to store the drugs at room temperature and not put it in the fridge or store them in the sun at home. Theme 3 was a short one, but let's just take stock before proceeding. Same-day initiation is encouraged, but if that is not possible, be sure to initiate the patient within 1 month. At that visit, confirm eligibility, repeat the HIV test, provide combination prevention, counsel the patient effectively, and script and dispense 1 month supply of oral PrEP. There are 28 days worth of PrEP medication per bottle, and remember the bottle should be stored at room temperature.
The clinical form used is central to patient management and is the first step in the M&E reporting process. It lays the foundation for the rest of the reporting process. It is also the only paper-based form in the set of reporting tools. The purpose of the clinical form is to record the details for each client that is offered and initiated on oral PrEP. Now, let's take a look at the form a little more closely. The form has 3 sections. The first section of the form is the block at the top of the page. This is where you will record a client's demographic information, name and surname, date of birth, the gender with which they identify, ID number if they have one, folder number, phone number, and address. The next section of the form is the steps prior to initiation. In this next section of the form is where the screening tests prior to initiating a client on PrEP is recorded. You will enter the date of the client's first visit, the HIV test results that was conducted, whether PrEP counselling was conducted, and whether the client has agreed to proceed with the screening tests for PrEP. You will record the results of the creatinine clearance once the results have been received from the lab, pregnancy test, patient's weight, hepatitis B result, also once the tests have been received from the lab, and whether the client has been screened for STIs. Only test results taken at initiation and reinitiation screening will always be recorded in this section of the form. In the last column of this section, you will record whether the client has decided to initiate on oral PrEP or not. If the client decides to initiate oral PrEP, you would record that and move on to the next section of the form. If the client decides not to initiate on oral PrEP, record this in the final column. The form will be kept in the client's file even if they decide not to initiate oral PrEP, and should be used again in the case that the client returns, tests HIV negative, and decides to initiate oral PrEP. The next section of the clinical form tracks the client's journey on oral PrEP, from the moment they receive the first pack of PrEP drugs through to all follow-up appointments. This section is only for clients who decide to initiate and who leave the clinic with their PrEP drugs. It is really important to remember that a client has not initiated on oral PrEP unless they leave the clinic with PrEP drugs in hand. Once a client decides to initiate, the first step is to record the original PrEP initiation date. This is the date that the client first receives PrEP drugs. This is an important date because the month and year that the client commenced PrEP will be the cohort that the client will belong to for the rest of their PrEP journey, regardless of whether they stop and restart. For example, if a client wants to initiate oral PrEP and then leaves your facility with their first pack of PrEP on January the 3rd, 2020, then this client is in the January 2020 cohort forever. No matter if they decide to discontinue in a month and restart 2 years later, they will still be part of the January 2020 cohort. On the right-hand side of the form, there's space to record whether a client has transferred in from another facility that offers oral PrEP. You must record information in this section if it applies to the client. Do remember that if a client is a transfer in, you must record the original date on which the client commenced PrEP at the previous facility as the original PrEP initiation date. Moving on to the first column with the numbered rows. These rows represent each month after a client starts PrEP. The shaded numbers are the months where clinical visits are required, where the clients should come back for a follow-up appointment and have their bloods taken and counseling conducted. The months start at month 0. This is the date of the visit on which the client was initiated on PrEP. The next column is where we record the appointment date for every clinic visit related to PrEP. The first thing to note is the next visit date. This is when the client's next appointment visit is scheduled. At month 0, you can leave this blank, as the client has only just started on oral PrEP. This becomes more important in the following months. The next column is where you would record the actual visit date, the date when the client actually presents at the clinic for the scheduled appointment. Recording the date of actual visit will help you recognize patterns with clients and assist them to find mechanisms to remember their future clinic appointments. For example, setting a reminder on their phone the first Tuesday of the month. The next column, remaining on PrEP, is where you record a simple yes or no to indicate whether the client is continuing oral PrEP use or not. At month 0, the initiation visit, this should always be recorded as a yes. Later on, you might see that a client might decide to discontinue PrEP, and this is where you would record a no. In the next few columns, you will record the results from tests and bloods that were taken during the client's appointment. At month 0, you can simply copy the results from the screening portion into month 0 row and record the date the blood was taken, not the date that the results were received. For follow-up appointments, you will record the dates blood were taken and the results right here. The following column is the outcomes column, where you record the reason a client stops using or cycles off PrEP. You only need to use this column if a client is no longer taking oral PrEP for some reason. Otherwise, it must be left blank as long as the client is continuing on PrEP. With regards to clinical monitoring, we need to be monitoring the following. Clinical visits. After a client starts oral PrEP, they need to return to the clinic to see the clinician, the nurse or the doctor, for a follow-up visit after 4 weeks and thereafter every 3 months or quarterly. The shaded rows in the clinical form represent the months at which you should set appointments for the client to return to see the clinician for follow-up counselling, to take their bloods, including an HIV test and creatinine clearance when required, and pregnancy screening if the client is female. You would then record all information for these client visits in the shaded rows. We have shaded the tests that are supposed to be done during each clinical visit to make it easier for you to remember. Before the client leaves his or her appointment, you will set a date for the next follow-up visit. Drug collection visits. The drug collection visit is the non-shaded months on the clinical form, where a client will return to pick up drugs or come for a follow-up visit. According to the PrEP guidelines, PrEP users should return in the drug collection months to pick up a 1-month supply of oral PrEP, but do not need to have any bloods taken unless they're requested or the clinician finds it necessary after counselling the client. That is it for the completion of the PrEP clinical form. Simple enough, don't you think?
We have come to the end of this video for Theme 3. It was a short one, but we will continue with the initiation process in Theme 4. Remember, you can come back to this video at any time and watch it as many times as you need to.